My journey with OCD started when I was 11 years old, and I didn't actually get the diagnosis till I was 30 years old. I think the average now is 12 years from onset to diagnosis, but mine was 20. And I always say that the one thing that's worse than living with OCD is living and not knowing that you have OCD.
I started developing symptoms of OCD when I was about 7 or 8 years old. Quite mild, sort of ritualistic symptoms. So doing certain rituals because of a feeling that something bad might happen if I didn't do them. It turned into quite noticeable contamination issues. So, spending a lot of time doing compulsive behaviours like washing and showering, being quite particular about who touched my things or what I touched.
I would get intrusive thoughts come in from, as I said, from the age of 11, and I wouldn't have any idea why I was having these intrusive thoughts.
Now, intrusive thoughts can be about literally anything. So it's really hard to put OCD into certain types. You might hear people say things like contamination OCD, checking OCD, harm OCD. Say you're walking over a bridge and you think, oh, what if I just threw my keys in? Or you saw someone with a tray of champagne glasses and you think, what would just happen if I just knocked it out of their hands? That's an intrusive thought. Everybody gets them. We get them hundreds of times a day and they just go out of our head. But for people with OCD, that thought gets stuck and we really, really worry about why we've had it. All OCD follows the same cycle: intrusive thought, anxiety, compulsion, temporary relief. But yeah, intrusive thoughts can be about literally anything. So really common ones are, fears of becoming ill or making other people ill, fears of accidentally causing harm. It could be sexual or blasphemous thoughts. There could be issues around, keeping people safe, worries about sort of electrical appliances or leaving the house for fear that something bad might happen there. These are all very, very common intrusive thoughts, and these lead to the compulsive behaviours. So common compulsive behaviours could be reassurance seeking, avoiding certain situations or objects, checking, washing or cleaning, order and symmetry. If I've used a tap in my house, I could stare at that tap for a good 10-15 minutes and convince myself it's on, even though I can see there's no water coming out of it. I can feel there's no water coming out of it. I can walk away and think, no, it's definitely off. I can't hear anything. What would even happen if it was on? But my brain will always tell me to go back and check it, stare at it a bit longer, because what if it is on, and what if you flood the house, and what if you cause loads of damage and it's your fault? And it sounds so silly because I know that it's off. I can see that it's off. I'm not silly. I can see physically that it's off, but it's that what if, and it's that part of our brain that makes us doubt those really simple sort of day-to-day decisions. But that happens all the time throughout the day. That's one small example in a 24-hour day. And that can be what it's like for people living with OCD all the time.